2 inches above the iliac
2
crest.
inches above for upright, because we want the diaphragm. And then for supine abdomen, we center at the level of the iliac crest.
Yes.
So the iliac crest is usually around L4, L5 area. And then of course, you're gonna ask the patient to point out their xiphoid process in order to find what plane?
MS.
MSP, yep. So, our palpation landmark is going to be our iliac crest, not our pubic symphysis. Please don't do that. And of course, we have our ases. We can palpate our greater trochanter, not number 6 and 7.
Yeah, don't do that.
Don't do that, please.
Old school techs used to do that. For real. They used to be a very popular way to palpate abdomens. They would actually, palpate in that area. It was common practice. An old tech I worked with, I used to watch her do that. It's like, thank God we don't do that anymore. I don't think they would fly these days. It's an old school way to find that landmark for abdomens.
Symphysis pubis is basically where the 2 pubis bones meet in the middle.
Oh, that little like space?
Mm-hmm. Yep.
See where 6 is pointing on the diagram?
Yes, Shani.
Oh.
Did all these 3 things make up the area size?
No, no, no.
Trochanter, symphysis?
No, these are just the different parts near the pelvis. They don't make up the pelvis. I mean, they make up the pelvis, but these are not all parts of each other.
Now, by the way, guys, y'all can put in your notes, because this will apply when we get to pelvis next semester, that pubic symphysis actually lines up almost exact with the greater trochanter. So if you wanted to use the pubic symphysis method, you could palpate the trochanter and still technically find it. And that's essentially where you want to put the bottom of your cassette, because as we talked about last time, you want to always include pubic symphysis on KUBs. That's a little way to double check yourself if you're scared of cutting it off.
So once again, we have our iliac crest here at the top. And that point right there is going to be our ases, which stands for
Anterior, superior.
iliac spine, yep.
All that.
And then right here is our pubis bone on both sides, and the area where they meet is the symphysis pubis. And like Mr. Donahue just said, the greater trochanter sits right at the level of the pubic symphysis. So if you want to include that on your X-ray image, you can palpate this right here and put the bottom of your light field right at that level. So you can be sure to include the pubic symphysis. So this is what an abdomen X-ray would typically look like. We have our spine right down the middle. It's pretty straight. We can see both of our iliac crests. And I don't particularly like this image because they didn't include the pubic symphysis. But you can see a little bit of the diaphragm up here. I would have either liked it a little higher or a little lower to include one of these.
What are they looking
For the KB. Abdomen, it could be a variety of reasons. It could be pain, it could be that the patient was throwing up, or that they put a nasogastric tube down to the stomach. It could be a variety of reasons. Yes, Jay.
What's that little white, looks like,
Right there?
Yeah.
What is that?
Those are kidney stones.
Ooh. Wow, those are big ones.
Not the wish of cheese.
But yes, so if you look closely, you can also see the faint outline of the liver.
Yeah, see that? Can't always see that, but
It's a weird
And, yep, and you can almost see the psoas muscles right there. But
What'd you
it's
call
very
me?
faint.
Psoas.
Where? You have to look at the.
No, that's how you pronounce it, psoas.
I was just like,
Oh.
Yeah.
It's very faint.
But on a better image, it'd be really.
Yes, yes.
So if y'all are labeling, like for image review exam, go back to that previous image for psoas muscles. Generally, that whole area of the sides of the abdomen between the ribs and the iliac crests would be okay for labeling psoas muscles. You got quite a bit of range of error for that in your labeling. Just to review, like, what anatomy you need to master on this KUB, because we're gonna have another image review exam on Monday. You need to be able to identify what part of that is the L spine. That'd be that whole column you see up until that 12th rib. Y'all see that?
Can you point out
You
this?
did-
What am I pointing at?
Make sure you can, when I say label L spine, you can use that whole range of the L spine for now. We're not gonna individually label those vertebrae yet. Ribs. If I say label the right ribs, you can do any of those ribs currently. You have quite a range as well. What else? Psoas muscles, like we just talked about. I want you guys to know, where are the iliac crests on that image? Where is the as is on that image? Correct. We can't see the greater trochanters, but if we could, you know that as well.
Right there on the marker.
Pubic symphysis, that's very important. We know where that is as well. And we'll show you some more demos here in a second. What else? If we saw air in the large intestine, which we can see a little bit over on the left side, we gotta label those specific parts of the colon we talked about on Monday. Y'all remember those parts? So if you'll run that laser on that left side where that air is, go down. Yeah, that area. What part of the large intestine would that be?
Transverse?
Descending colon,
Oh,
correct.
descending.
Correct. We can see a little bit of the transverse as well. That's the transverse.
Oh,
Can't really see much of the ascending, so it's dependent on what we can see as far as contrast and air. You're gonna see on some of these demo images coming up, how we can label those individual parts. Much more on that
Much
one.
better here.
We
So
can see flexures on that one.
what's this part right here? Ascending, and then that's obviously descending.
Can y'all see the splenic flexure?
Is that the little?
It's the corner, right?
The corner,
Mhm.
correct.
The corner where transverse and it goes down into the descending.
Now we can see the pubic symphysis as well,
Right there.
very clear.
And there's our greater trochanter. We got our iliac crest. And on this image, you can see the psoas muscles
Yeah.
on both sides. Did Mr. Donahue go over the purpose of the psoas muscle?
They're to hold everything together.
It connects the upper body to the lower body.
How about the ASIs, you know?
I'm sorry? What looks different?
It's called the oval.
What was your question?
Like, how come they look different? Like,
These?
they don't look symmetrical.
That means that the patient's hips are
Patient
rotated.
probably tilted a little bit.
Oh, okay.
Good eye.
Ma'am,
Very
where's
good.
the ASIs in this picture?
Asses is,
Big cut off.
got cut off, but it should be right there.
And one final thing I didn't mention before, guys, remember the olives as well. Olives of the pelvis, you know those two. That's that flat area you see on each side of the pelvis.
Are we gonna have to know the sacrum?
Not yet.
Not yet. Okay.
We have a great image.
Okay. What do you think this is?
Contrast.
Contrast, exactly. So this study would be called a small bowel follow through, and the purpose of this would be to identify if there's some sort of blockage that's going on in the intestines. If the patient's having a hard time like passing bowel movements or anything like that, they would do a barium or small bowel follow through study and have the patient drink the barium so that it coats all of the intestines, and so they'll be able to see what's going on and where it's going on.
The barium tastes nasty.
I've never tried it myself,
I don't
but
think it's that
I
bad.
don't.
Oh, the stuff you drink when you're looking.
Oh, I tried it on day one.
The stuff that you drink when
It,
you're
I hear it's
looking.
very chalky.
It tastes like milk and magnesia. I've never had that before.
I
Does
haven't.
It's chalky and
Colonoscopy and all
thick.
that stuff.
Doesn't it make you feel like you're peeing
No,
or
that's
something?
like,
Like
That's the
Like you're
contrast.
peeing?
That's the
Not this
contrast is the
contrast, that's the CT contrast.
Yeah.
That makes you feel like you're peeing. So, whenever you get this study done, oftentimes radiologists want you to take X-ray images at certain intervals, like every hour or every 2 hours, just so they can track how it's moving through the intestines.
Looks great.
now we can, before you go forward, we can label those parts of the small intestine. Remember the ones we reviewed?
Ascending, descending.
So you see the stomach. After the stomach comes the what, guys? What's the first part of the small intestine?
The duodenum.
The duodenum. So the duodenum would be right about that area there. jejunum, which is gonna be on that left portion of the small intestine. That's more ileum there,
The left, the other.
towards the stomach.
Towards
Like, because this is real
On the
important, y'all
opposite.
need to know this for your test. So, stomach, duodenum right here, this will all be jejunum, this will all be ileum right here. Which one's the shortest and widest? Which one's the longest portion? Ileum, correct. And even though we can see some large intestine there, an image like this should be more focused on the small intestine. I got some more images to show you how that large intestine will look, not superimposed on top of that.
Mr. Donahue?
Yeah.
Are we gonna know? Are we gonna need to know the exact junction between the duodenum and the stomach? I remember in the anatomy that
The
there's-
junction, no, not yet.
Okay.
That's Rad Pro 4. More of a general overview right now.
And one way you guys can remember is that ileum has an L in it, so longest, and then duodenum has the most amount of letters, so it's the widest.
It's good.
Easy way to remember. Another barium study. This one's prone. So the patient was laying on their stomach. You can see that the intestines look kind of squished. Now, why would they do a prone abdomen image?
To not see the kidney?
A patient that can't stand up or lay on their back.
Because they have cysts.
Yeah, if they have bed sores, back pain, whatever the case may be. Prone, I have never really seen prone abdomen images.
It's not very common.
Not very common, yeah.
Y'all notice too on that, look, do y'all see how much lower the small intestines are?
Yeah.
Compared to the previous image? What's that tell us? The person's probably more what?
Stomach?
Extended.
Yeah.
Correct. And if you don't mind, Ms. Donahue, if you could just show those three portions of the small intestine again. Just,
This on this image,
yeah.
so
Duodenum right after the stomach. Then jejunum, so we need that portion right there. And then the ileum. Making sense?
no.
So are they
No.
just like raised?
So we have our stomach right there, and then after the stomach comes what? Duodenum, and then we go down and we have the ileum. And then what is the body part called where the ileum connects to the cecum?
Sickle, yeah.
It's the iliocecal.
It terminates the
Yes,
leg
correct.
against the
Ileocecal valve.
large
You can't see that on this X-ray image, they'll do what's called a spot film to find that in fluoro. Just see them fill out a little paddle, and they'll compress the patient's stomach with the paddle, it has a little balloon on it. And that'll move those valves out of the way, so they can see that valve specifically, if we wanna analyze it.
Oh, I'm sorry.
Ooh, that's a great image too.
Alright, what do you guys think is going on here?
That's air.
It's ascending.
You were not supposed to answer, Mr.
Oh,
Donahue.
I'm sorry, I was answering his question. I'm sorry. Sorry, I can't help myself. I'm
The
just
whole
So
gonna-
is this the large intestine or the small intestine?
Large intestine.
Okay, so we have, what is this?
Ascending colon.
And then we have
Transverse.
transverse, and what's this part called? No. The splenic flexure.
What's
and
that
then
one?
Descending, and then. Oh, what the
The sigma.
heck? Sigmoid, yep.
So is the splenic flexion the same as the colic?
So the splenic is synonymous with the word left colic.
Oh.
Hepatic is synonymous with right colic. Two ways of saying the same thing.
What was at the end? Sigmoid and
Sigmoid, and then we have our rectum, and then it ends in the anus. Yep.
I got a fun bonus question for y'all. Where are those little ridges on the large intestine called? You might know. See all those little indentations? It looks kind of little bumps all over it. That'd be a good bonus question.
I don't know that one.
That's the hostra. Called the hostra.
The
of the large
hostra.
intestine.
So, why? Why so much air in the large intestine? Is it just like gas or?
It could be a combination of gas and feces.
you spell it?
So they have obstruction.
Australia.
So that's not like an impacted bowel syndrome or something like that, or?
Yes, this could be caused by the IBS.
Okay.
HASTRA.
So you said it's gas and probably.
Can you go back on the picture slide real quick?
Alright, he said HAUSTRA.
HAUSTRA.
And can you go back one more time?
Singular, yeah, EN plural.
Oh yeah, that's
Okay.
clear.
HAU.
Thank you.
Was that all
No, it was
Oh, yeah, yeah.
I think I got moved.
All right, review question time. Which two of the,
Oh, I'm sorry.
what did you say?
false.
I think that's an answer to it.
I'm sorry, that was not an option. Which two of the following are in the retroperitoneum?
The
Yes.
kidney.
kidneys and the pancreas.
Yay!
Very good.
So why would it not be the bladder, ovaries, spleen, or rectum?
They're not in the retroperitoneum.
Yes, bladder is towards the front, and so are the ovaries. Spleen is more towards the middle, and the rectum is not part of the peritoneum.
The retro kind of means behind.
Spleen is a real thing.
You know, working on that word. Posterior aspect.
The pelvic cavity contains all of the following except. Yep. Everything else is in the pelvic area except for the gallbladder. Okay. All right, now we're going to talk about abdominal pathology.
That's a gold star pathology right there.
There's a gold
A
star
gold
on there. So, ascites. It is the accumulation of fluid in the peritoneal cavity, causing abdominal swelling. So, what do you think causes ascites? So it could be caused by cirrhosis of the liver if someone drinks a lot, and it's also caused by different types of cancer. So what happens is, it's funny, no.
She drinks.
Drinks a lot. Drinks a lot, yes. So what happens is, there's a lot of pressure in the blood vessels of the liver, and then it can't withstand that much pressure, so the fluid ends up leaking into the bloodstream, and it stays kind of in the abdomen area. And so if your liver is not functioning correctly, this is what's gonna happen.
A lot of babies get that too.
Babies?
Drinking too much?
Ow.
Too much milk?
Infection. Massive infections internally. Can't really see it very well on that KDB, but
Yeah.
if they were doing like a dorsal decubitus or a left lateral decubitus, you'd be able to see that fluid falling.
Is there anywhere else that there's like pictures of like radiographs? Cause I don't like Google this stuff and then like,
It'd be wrong.
yeah, and then.
My advice to you is don't use Google.
Is there anywhere else that we could find like example pictures and?
There is a website that's escaping me off the top of my head right now.
Okay.
If you remind me, I can let you know. There is a good website for reference images on that, yes.
Okay.
Would the picture on the right be acceptable,
Yes.
even with the digital marker?
I don't,
It's
Is
not a
it-
digital marker.
I
That's
don't
not?
think that's a digital marker.
To the left and right.
What's the picture of the right showing?
Ascites. Although it's not really doing a good job.
There's a fluid in the peritoneum, so there's the peritoneum. There's the fluid line.
You can't really see.
So see how it's very whitish? Usually it
It's washed
shouldn't be,
out.
yeah, it
It's a
shouldn't
washed
be
out look.
this whitish in the abdomen area. So that tells you that there's some sort of fluid present. And then we have pneumoperitoneum, which is free air in the peritoneal cavity.
You don't see it? On the left image? Great question. Is that pneumoperitoneum on the left side or the right side? Because people make this mistake quite often.
Right.
Or is it both?
I think it's both.
Is that the diaphragm?
It looks like it's both.
No, that's a division of the air. I mean, I guess, yeah, that's the base along diaphragm, but that is the pneumoperitoneum right there on the right side, right underneath the lung. It's pushing up on the lung. That's not part of the lung. So did y'all think that was caused for an angle there?
Yeah.
Like the dark area
That's
right
all
here.
air. Y'all see that line splitting it in two?
Wow.
That line is where the diaphragm or base of the lung is. If you look on the left side, that's normal. That's actually air in the stomach, which is quite common. So when you look at pneumoperitoneum, you see that very distinct line dividing the two areas on the right side of that lung. You see what I'm talking about? Right there. And the image on the right is just not it's just showing a normal chest X-ray for comparison.
What is that line divided?
You said a distinct line
It's
that
called
what?
the line again.
See that line going through right there?
Yeah.
So that is air underneath the lung in that peritoneal cavity. That's not part of the lung we're seeing there. Even though it kind of looks like the lung.
So all this does not belong to the lung?
It's free air and stuff.
In the peritoneal cavity.
In the peritoneal cavity. What's free air in the thoracic cavity?
That's a good question. We already went
You
over
want
that.
to know.
Pneumothorax, yes.
See how the answer's kind of in the word? The word kind of answers the question.
So I have another follow-up question. How do you think people get pneumothorax or free air in the thoracic cavity?
Because of gas and all.
No, in the thorax.
I see.
So we know we have air in the lungs, correct? So how do we get air in the cavity outside of the lungs?
There have function alone.
Yep.
Very good.
So air escapes the lungs and then it sits in that cavity between the chest wall and the lungs. So that's a place where air does not belong and it causes the lung to collapse. So relating to the stomach, how do you think people get air in the peritoneal cavity? Same thing, exactly. So, if you want to look for free air in the peritoneal cavity, the number one thing that we would do is a left lateral decubitus. If you look closely here, you can see the air is right there at the top, shown by the white arrow. And then the black arrow, you can see it's kind of like grayish, it's fluid. Now, why would we not do a right lateral decubitus if we were looking for free air?
Because that's the fluid. We want the air to go up.
Because if we do a right lateral decubitus, it would be obstructed by our gastric bubble. So we couldn't be able to tell, is that air in the stomach or is that free air? Does that make sense?
That's a very important point to write down, guys.
And
As far as
this
goals are.
question will definitely be on the registry.
Yes.
And seniors still don't understand this.
No, we don't.
So free air will be black and then free fluid will be grayish.
Grayish, yes.
In fact, most of your DQs on the abdomens, guys, you almost always optimally are gonna opt for that left lateral unless a doctor specifically wants a right lateral. That's super rare. They would ever ask for that.
So air anywhere should look black.
So we wouldn't do the right one because we wouldn't be able to distinguish between the air bubble and the free air, correct?
Correct, because if we do a right lateral decubitus, our right side would be down, our left side would be up on the image, correct? And what's on our left side?
Heart,
No, on the stomach.
on the
Gastric bubble.
Our stomach. So if a radiologist were looking for free air, which is air outside of the organs, we wouldn't want it to be obstructed by the stomach. That's why we prefer to do the left lateral decubitus. And sometimes they also do a PA erect chest as well.
So are we gonna, anytime that we're looking
air is going to rise up away from whatever side is down.
And the fluid is the side up.
Air rises and fluid falls.
That's where it differs from a chest, guys, so don't mix it up with chest. For abdomen specifically, you stick with that left bowel, because this is the most optimal view of that free air and
It's the stomach
fluid.
will block it.
Because of the stomach, correct.
Right. Now, if there was a question that asked you, if you're looking for free air in the peritoneal cavity, and our options were right lateral decubitus, PA erect chest, supine, what would be the best answer?
For air in the abdominal cavity?
If we were looking for free air in the peritoneum,
Be the left lateral disease.
but that was not an option.
So you said supine,
Supine, right lateral decubitus, or PA erect chest.
Yeah, right.
PA erect.
Yeah.
Right lateral decubitus is not going to give us the best image, because it's not gonna show us where exactly the air is, correct?
Is that a lead on the bottom of the picture?
Right there?
Mm-hmm.
I don't know
It's a
what that
peg
is.
tube.
The what?
Peg tube.
Oh, peg tube.
So that person's probably having issues with feeding, and they'll inject the food through that tube directly into the stomach.
Wow.
See a lot in pediatrics.
Yep.
Peg tube or J tube.
G-tube, something like that.
So is this a kid?
Why?
Is this a kid?
Yeah, like is this a pediatric?
It's more like a teenager than a kid, because the ribs is
spine?